All right, let's jump right in. Today, we're basically becoming medical detectives. We're going to follow the exact clues doctors use to solve a really complex case, a severe first-time headache. And this isn't just about finding an answer, it's about seeing how they navigate a journey where every single step is critical.
Okay, so picture this. Someone shows up at a clinic with the worst headache of their life. The first one they've ever had that's this bad. Something just feels off. For a doctor, that's a massive signal. It's a mystery that has to be solved and solved carefully. I mean, where do you even begin?
Now, we're not just talking about any old headache. This specific kind raises a huge red flag, the possibility of increased pressure inside the skull. So to figure this out, doctors don't just guess. They follow a very precise map, a step-by-step algorithm that's designed to find the real cause, all while ruling out the most dangerous stuff first.
So, the very first piece of our puzzle comes from some pretty advanced imaging. You start with a standard MRI to get a good look at the brain's structure, but that's usually paired with an MRA or an MRV. These are special scans that basically give us a roadmap of the brain's arteries and veins. This combination gives us our first and most important set of clues.
And right out of the gate, we hit a massive fork in the road. See, the results from that initial MRI are going to send the investigation down one of two completely different paths. Either the scan finds something, a positive finding, or it comes back totally clear. So let's start by exploring that first path.
Let's follow that first trail. In this scenario, the MRI just lights up. It finds a clear, physical, tangible reason for the pressure building up in the brain. You can think of it like finding a suspect right at the scene of the crime. The next step, of course, is to figure out exactly what we're dealing with.
A lot of the time, the culprits are what doctors call space-occupying lesions, which is a very direct way of saying there's something in there that's taking up space where it shouldn't be. This could be an infection that's made its way to the brain, like neurocysticercosis, which comes from a parasite, or a tuberculoma from TB, or it could be a brain tumor.
But the list of physical causes doesn't stop there. A positive MRI can uncover some more complex problems, like tumors that are pressing on really critical structures, or infiltrative diseases, like sarcoidosis, where you get these lesions made of inflammatory cells. There's even a rare condition called lymphocytic hypophysitis, which, believe it or not, is often seen in women right after childbirth. It just goes to show how specific these scans can get. Okay, let's hit rewind. Let's go back to that fork in the road and take the other path. What happens if that crucial initial MRI comes back completely clear? It definitely doesn't mean the case is closed. Nope. It just means the mystery is a lot deeper, and the cause isn't something obvious taking up space.
So this is a huge moment in the diagnostic journey. The most obvious suspects have been ruled out. They all have an alibi. So if it's not a physical mass pushing on things, what on earth could be cranking up the pressure inside the skull? The investigation has to pivot to look for a totally different kind of problem. And this is where we bring in a more specialized tool, the MR venogram, or MRV. We mentioned it earlier, but now it's the star of the show. This scan isn't focused on the brain tissue itself. It's designed to look at the venous system. You know, the whole network of veins that drains blood from the brain. We've basically switched from looking for a structural problem to investigating a potential plumbing problem.
And you know what? This test, the MR venogram, is so often the thing that cracks the case wide open when the first MRI is clear. It presents us with our final fork in the road, leading us to one of two very specific diagnoses that finally explain what's going on.
And just like before, the outcome splits our path one last time. Either the veins look totally normal, with blood flowing just fine, or the venogram flags an abnormality, a blockage, some other kind of issue. Each result points to a very different conclusion.
So let's say the MR venogram comes back looking great. The plumbing is fine. In that case, the diagnosis is often benign intracranial hypertension. It basically means there's high pressure in the skull, but there's no detectable tumor, no lesion, no clot causing it. The why is still a bit of a mystery, but we figured out the what.
But what about that other possibility? What if the venogram is not normal? What if the plumbing isn't fine at all? Well, this leads us to our final and very significant diagnosis on this whole journey.
A positive venogram will often reveal something called a cerebral venous thrombosis. In plain English, that's a blood clot that's blocking one of the brain's major draining veins. And this is a big deal. It's the second most common cause of this whole headache presentation. The drain gets clogged, things back up, and that's what increases the pressure. Finding the clot is a huge breakthrough, but the investigation's not quite over. A good detective always asks the next question: why? Why did that clot form in the first place? Answering that is absolutely key for treatment and for making sure it doesn't happen again.
The causes for a clot like this usually fall into two big buckets. They can be inherited, so a genetic predisposition to clotting, like the factor V Leiden mutation, or they can be acquired, triggered by something else. That includes things like the postpartum period after having a baby, or an autoimmune disorder like antiphospholipid antibody syndrome, which makes your blood much more likely to clot.
So when you step back, it's pretty incredible. What starts as just one scary symptom, a severe headache, unfolds into this logical, step-by-step investigation. From a broad look with an MRI to super specialized scans, each test tells another piece of the story, narrowing down all the possibilities until you finally land on a precise diagnosis. It's a powerful thing to see.